Hi, dear listeners. African Emotion is inviting you to navigate this journey where we study the body and health. We are going to learn how the body works, the conditions that affect the body, different diseases. We will start from the head to toes. We will try the best to address all the questions that many people ask themselves. We'll work together. I'm welcoming you so that you can learn. We'll start from the brain. We study the conditions that affect the brain, either stroke, abscesses, mental condition, all the conditions that we know affect the brain, we'll address them. We study the different ways the body works to function, what we call physiology, the way the body functions. You can see these wires, the wires that the body uses to control different organs. We try to understand whether you want to flex your arms, you want to flex your legs, they are controlled. So we try to analyze in a very simple, easy way to understand, and questions will be welcome so that we can address what we don't understand. We study the eye, different conditions that affect the eye. We go inside the eye, we check. We know, we have heard about what we call cataract. When this lens is obliterated, the image cannot pass through. We'll study what are the causes, what's the management. We know, we have heard about retina. This part which helps a lot on fixing image, and information will be transferred to the brain for interpretation. We'll study all of that. We'll study the ear, the functions of the ear, whether the external ear or internal ear. You can see from the external part of the ear, we come to the drama and there is this inner part which we call middle ear, and the different parts that helps now to collect information for hearing, and this part, semicircular canals, which help on stability. We'll study all of that. We will study the skin, different conditions that affect the skin and different way of managing it. We know the skin has different layers. There are conditions that affect the superficial part, the deeper part, and even till the muscle. We study all of that. We will also study the nose, the organ that helps in breathing in and out. You can see there is the bony part, and there is a soft part. All of these, they have very big role they play in respiration. You can see, we have heard about people suffering from sinusitis. These are the sinuses, and when infections are very bad, they can even go easily to the brain. We will study those different conditions that affect the nose. Oral cavity. Oral cavity can have different conditions, whether on the teeth, the tongue, the cheeks, even to the esophagus. We will go and study the usefulness of teeth, not only using for chewing. They provide the beautiful smile, isn't it? We will continue study the digestive system. From the time you chew your food, you swallow, coming to esophagus, to stomach, get mixed with some secretions from the liver and pancreas, digestion to the large intestines until the exit. We'll study the way it works and the conditions that affect it. The lungs. The lungs, important organs that help a lot in respiration. We know today we are talking about the coronavirus. We know we are in an endemic region where TB has caused a lot of damages, mainly to the lung. Yes, it can attack other organs, but mainly the lungs. So we study diseases that affect lungs, the signs, symptoms, and how to manage it. We will study the deeper part of the lung, the functional unit the functional unit called alveoli. That is mainly the focus of many lung problems. The heart, the beautiful organ that helps a lot in pumping blood in whole system. This organ will send the blood to the brain, to the arms, to the lower limbs, and it starts as early as possible after conception. In 21 days, the heart starts beating. We'll start all these organs. You can see these, the valves. We'll study the condition that affect the muscle. We'll study the condition that affect these vessels. We've heard about heart attack. We will try the best to understand all of this. The kidneys, important organs that help a lot in removing toxins in the system, whether for female or male. They do the same job. They take all the toxins through urine, put in the bladder, then we eliminate them. They do help a lot in fabrication of blood. We investigate those. We study also the conditions that affect couples related to fertility or other conditions, whether transmittable infections or other problems that the couple might face. Going deeper to the internal organs, from the external genitalia, vagina, uterus, going all along to fallopian tube. These are the fallopian tubes and the ovaries. We need to understand in the different conditions that affect these organs. We also do the same on a male, where the male, from the external part, in the penis there is the urethra. There are diseases that can affect this part, including the prostate gland. And there is another canal that would be bringing the spermatozoa coming from the testes. But now, once we don't understand this, it would be a little bit difficult to understand the diseases that affect these organs. We've heard about rheumatoid arthritis or just arthritis, bones, fractures, road accidents. All these are the conditions that affect people that we need to know, that we need to learn, that we need to know how to prevent and minimize incidences. Lymphoid organs, we call it lymphatic system, where you can see, we know there are blood vessels in the body. There are nerves which help in sensation, but we have these other types of wires in the system. These types of wires, they help a lot because they would be helping on targeting where the bacteria are, and they bring them where the nodes are. We have heard about lymph nodes. You see, they are everywhere. In normal circumstances, you don't feel them, but when there is a fight, they will swell. So we'll study them as well. We know that there are many soldiers which help a lot in protecting the body. These are the soldiers of the body. We know the blood, we know the platelets, which help a lot on helping on clotting when you are bleeding. We need to study all these components. Now, it is very important to protect. Africa in Motion will focus a lot on protection, on prevention, on promotion. That is public health. Once we have done this, we are almost 100% sure that will make a difference in many people's lives. I'm welcoming you to come and navigate with us all these topics. Thank you so much. I'm welcoming you to this wonderful project of learning how the body works. Health education, health promotion. You are always welcome to check for more topics on our website, or you can send an email address. We thank you so much.